morning. Welcome to Radio Friends on Friday, December the 17th. We're going to talk about something that's very important today. It's not a real happy subject. It's lung cancer. But it's something that we do need to talk about. And I'm going to introduce you to two of our guests, Dr. Satish Kalanjeri and Dr. Jeremy Johnson, both from the Truman Veterans Hospital. We were talking before we went on the air here. You were giving me some statistics about lung cancer. Tell me how many people die from lung cancer.
Well, it is estimated that in the United States, about 150,000 patients might die of lung cancer each year. Now, more importantly, well, equally importantly, is another grim statistics. Lung cancer causes more cancer-related deaths than prostate cancer, colon cancer, and breast cancer put together.
Lung cancer causes more cancer-related deaths than the three others put together.
That is correct.
Why is that?
The reasons are multifold. One, each cancer behaves differently from the other. But another reason is that lung cancer is often not detected at an early stage. For example, a statistic to bear in mind is that only about 18% of all patients with lung cancer survive to 5 years, as compared to 98% of patients with prostate and 90% of patients with breast cancer. Why is this? One reason is that over half the patients, almost 60% of patients with lung cancer, are detected at an advanced stage. In advanced stage lung cancer patients, only about 6% of them survive to 5 years. So you see the problem here is we fail to detect lung cancer at an early stage.
So what you're wanting to do, and the message you want to get across today, is early detection of lung cancer. But obviously, you're not going to be able to screen everybody. You're looking at folks who are the highest risk of lung cancer, correct?
That is absolutely right.
And so we were talking, I wouldn't be in the high-risk category because I don't smoke and I've never smoked.
That is correct.
But somebody who has smoked for a period of time or all of their life, they are in that high-risk category.
That is correct. Now, the high-risk category as far as lung cancer screening is concerned, the way we look at it is we choose patients who have smoked an X amount of cigarettes over their lifetime. We call it pack years. So if someone has smoked 30 pack years of worth of cigarettes over their lifetime within the last 15 years at least, then those patients are eligible. A pack year is one pack of a cigarette a day for 30 years or 2 packs of cigarettes for 15 years. You do the math. So if it is about 30 pack year history of smoking, and if they've smoked up until 15 years ago or within the last 15 years, then they're eligible for lung cancer screening. And we choose patients who are a little older, 55 to 80 years of age.
Okay. Now, I'm going to ask you, Dr. Johnson. He said if somebody has smoked a pack of cigarettes a day for 30 years or 2 packs for 15 years, what if they did that 30 years ago? They were smoking 2 packs a day for 15 years 30 years ago. Haven't put another cigarette or cigar in their mouth since then. Are they still high risk?
That patient that you just described is probably not a patient that's going to qualify for lung cancer screening by low-dose CT scan. So there's different task force or organizing bodies that have given us the criteria, and we've learned this data by studying and testing over the past 10 years. Before 10 years ago, we didn't talk about lung cancer screening because there was nothing that really demonstrated that we could save lives or help people live longer after they were diagnosed with cancer. So right now, to reiterate what Dr. Kalanjeri said, basically somebody age 55 to 80, they've smoked at least 30 pack years, as you pointed out, but that they're still actively smoking now, or they've quit within 15 years. So to answer your question, if they've quit longer than 15 years ago, their risk for lung cancer goes down quite dramatically after they've been smoke-free for more than 15 years. So those people now are no longer considered high risk, and they would not be eligible for screening.
I remember years ago we had two, when we were doing the Pepper and Friends television show, we had two lungs that a doctor brought out. One was a healthy lung, one was a smoker's lung. The smoker's lung was black as tar. Yeah. The healthy lung was sort of pink. Will the lung, when you stop smoking, does it go back to that healthy-looking lung again, or will it stay black for the rest of their life?
More than likely, it'll stay black for the rest of their life. And one reason why cancer occurs in patients who smoke is because of the irritation that smoking causes on the surface of the breathing tubes and the lungs. So the changes that have occurred may not reverse. That said, the risk for developing lung cancer or any other problem with smoking does go down over time, and it is estimated in about 5 to 10 years after quitting smoking, the risk of developing lung cancer is cut by half.
Okay, so that's very good information right there. If you are smoking, you need to stop smoking. And if you stopped 5 years ago, stay that way. Don't go back.
Can I please make a very important point?
Yeah.
So the risk of cancer doesn't go completely away, even if they've smoked, they've quit more than 15 years ago. So it's very important for that patient not to ignore symptoms. And so if they develop any symptoms, shortness of breath, new cough, they still need to talk to their doctor, because then it may not be screening, it may be looking and searching for lung cancer.
Okay, so what are the symptoms?
Don't ignore the symptoms.
The symptoms are?
It could be anything vague that's respiratory, worsening shortness of breath, a new cough, for sure cough with sputum production that's bloody, or what we call hemoptysis, coughing up blood. Weight loss, any weight loss that we're not trying to lose is concerning for some type of cancer. And if they had the history of smoking, then we still need to search for lung cancer.
All right. Doctor, we're out of time, but if people want more information, what can they do?
Well, they can contact their primary care physician at the Truman VA Hospital, or they can contact the pulmonologist. I'd also like to point out that this is not just a topic for the veterans, but for the general public. So if you think you'd benefit from lung cancer screening, or you just want to find out, call Boone Hospital PCP or the pulmonologist, or the University Hospital primary care physician or pulmonologist. All of the hospitals in town offer lung cancer screening services.
Thank you very much.
Thank you, Paul.
It's very informative. I appreciate you coming out and visiting with us today.
Thank you very much.
Okay? A Merry Christmas to both of you, and hope we'll see you in 2022.
Will do. Thank you. And Merry Christmas to you and your viewers too.
All right.
Thank you.
Bye-bye.